Well, welcome everyone, and thank you so much for joining us today to learn about the UAB School of Nursing. My name is Meredith Call, and I'm clearly having a little technical difficulty, so I apologize to everyone. There we go. My name is Meredith Call, and I serve as the Director for Parent and Family Services here at UAB, and I'm so excited that you're able to join us today for our School of Nursing webinar. I want to make sure that everyone knows that we want this to be a highly interactive and engaging webinar throughout the day today. So as you have questions or things that pop up as a result of today's presentation, please make sure that you put those questions or things in the Q&A function, which you will find at the bottom of the Zoom platform if you're watching this via Zoom. If you're joining us via the Facebook Live, we're monitoring that section as well. So all you have to do there is put your questions into the comments section, and we'll be able to interact, engage, and answer your questions. We want to make sure our students and family members are able to get all of the questions that they have answered, whether you're starting to be this fall or even to be part of our UAB School of Nursing community. And so just a few things to know. Again, we want this to be highly interactive and engaging, but we want to make sure that you share the questions with us, but be careful when you do so that you're not providing any type of interactive or not interactive identifying information regarding your students. This could be your students, this could be their trust, anything like that would actually identify your full student. You just want to make sure we're maintaining the security and privacy of our students. So to get started, I know there's some little audio issues with myself right now, so we're going to turn it over to Lee Whitman from our UAB School of Nursing. We're going to stop talking here in a second and send over to Emily and let her share everything related to the School of Nursing and her options.
Perfect. Hi guys. Hope everyone's doing well today. So I'm so glad to be with you. I'm going to take just a moment and get my screen pulled up. So if you'll bear with me for just a moment. You should be seeing my screen shortly. Here we go. All right, so hopefully everyone can hear me all right today. As Meredith mentioned, my name is Lee Whitman, and I am with the School of Nursing. You should see in front of you my contact information. If you're not using your phone and using a computer, I would love for you to take your phone and snap a picture of my contact information. It's always great to have a contact in our school. And I always love to tell our students to think of me as a resource for you. I'm one of the many people you'll find as a resource. And I always tell our students that I am your biggest cheerleader as far as someone who is going to be there for you from the moment you step onto campus until graduation. I work in the Office of Student Success, and we are the office within the School of Nursing that does work with students from the moment they step onto campus throughout their journey here in the School of Nursing. So I could not be more thrilled that you're here with us today. Before we get started to learn more about the school and to hear about what it takes to become a great nursing student and a competent nurse, I have a short message from our dean. She was not able to be with us today, but she certainly wanted to join us in the form of presenting just a greeting with you and getting to speak with you briefly. So this message is a few minutes, and if you'll take a moment just to get the chance to hear from her.
You know, as Dean of the UAB School of Nursing, I am so pleased to welcome you to this presentation about our school. And I'm excited about sharing some of our school's facts and who we are. And hopefully you'll have a better picture of who we are after I finish. So UAB School of Nursing is co-located on UAB's Academic Health System campus, the state's renowned public hospital and health system, with prominent faculty from around the globe. UAB Hospital is one of 24 hospitals in the world that has been designated as a magnet hospital for its nursing excellence, and that is the 5th time in a row. Our School of Nursing was founded in 1950, and it is the first publicly funded school of nursing in Alabama, and we are celebrating our 70th anniversary in 2020. UAB School of Nursing's mission as part of the Research University and Academic Health Center shapes patient-centered healthcare by preparing recognized nurse leaders who excel as clinicians, researchers, and educators in Alabama, nationally and internationally. We offer our students opportunities to learn and investigate with health professionals, faculty, and student teams from across the campus, including from the School of Medicine, Dentistry, Optometry, Public Health, and our allied health professions. The COVID-19 changed how we delivered our classes and our educational programs in spring and summer. But I can tell you our faculty and staff and students adapted quickly over the last several months. They pivoted in March to move education remotely, but to continue our high quality classroom skills and simulation learning experiences. And our students adapted well to the change. They graduated on time. They've started to take their boards, and I can share with you that our board pass rate for 2019 was 97% and above. They've started their first jobs, and 70 to 75% of our students work at UAB Hospital and Health System. From the students from spring, and we have had many who already had jobs before graduation. So our students and faculty have continued to adapt, allowing us to provide the highest quality education and requirements necessary to stay on track for the summer graduation. In fact, we began our clinicals here in June because we have a strong partnership with UAB Hospital and Health System. That means our UAB students come first. Our students are afforded the opportunity to get back into clinicals before many other schools in the state or the nation. Our students gain valuable learning experiences at one of the top hospitals and health systems in the country, where science and innovation drive excellent patient care and their education. Your students have chosen a profession that is of great need now more than ever. In fact, nursing was ranked #1 among all the health professions as the most trusted profession by the Gallup poll this year. Sometimes parents that aren't in nursing or in another profession don't understand why a child wants to become a nurse and work in a clinical setting. I can share with you, it's truly a commitment to the integration of science, caring, compassion, and technology. Nursing is a rewarding lifetime career with countless opportunities for advancement. Parents, however, can expect we will take very good care of your students, protecting their health and safety while they work toward their academic goals. So in addition to our usual education and training here at the School of Nursing, we have instituted COVID training, screening, and testing, and the latest updates on COVID, which are changing daily. We are supplying personal protective equipment for our students so that they are never in a position without what they need to be safe in a clinical environment. I will share with you some of the realities of nursing school in general. First of all, nursing is a difficult curriculum designed for full-time study with clinicals that take all day long, sometimes 2 and 3 days a week. And it's based on a strong science and social science foundation. So often our students have some highs and lows that are pretty predictable, that are associated with the stress level they feel in this curriculum. But UAB School of Nursing has faculty who care, and we are equipped with the resources to provide the assistance, the tutoring, the mentoring, the advising or counseling, including state-of-the-art learning facilities. We built a building here and opened in 2018 that houses a nursing simulation center that includes an operating room, nursing units with ICUs, obstetrics, pediatrics, medical surgical centers, a home health center, and an infusion center. And what I can share with you is never in 2018 did we envision that we would be in the kind of environment we are in today, but our building is equipped for social distancing and safe education. Nursing is a demanding profession that requires focus, emotional intelligence, an inquiring mind, and the ability to lead and collaborate with others. But it is a great choice and a career for a lifetime that a student or your child will never forget. So I encourage you to ask your students to listen. Ask questions, speak up, and take advantage of the opportunities afforded at this wonderful institution. We'd love to have your students here at UAB. Thank you.
All right, like I mentioned, it was very important for her to be able to speak to you so you could hear from her directly today. But as we continue to have this conversation, she spoke on many of the topics that we are going to touch on, and I just want to dive a little bit deeper. But for anyone who's not familiar with the field of nursing, there are so many acronyms and so many ways that a person can become a nurse. The only way that we offer an entry-level program into nursing on campus is our Bachelor's of Science into Nursing. Now, you may be familiar with other ways of becoming a nurse, and within our community colleges, there's a program called the Associate's Degree of Nursing. We offer a pathway for students to do the RN to BSN, but that is an online program. So your student coming to campus here is going to be doing the Bachelor's of Science in Nursing, and that's the most direct pathway to get the bachelor's degree here on campus. Another pre-licensure program is the Accelerated Master's in Nursing pathway, and that's for a student who goes first into a non-nursing bachelor's degree, let's say history, chemistry, or some other field, and then changes their mind and decides they want to be a nurse. So it's a second degree pathway. So it's definitely not the most straightforward pathway, but it is a pathway, and it is accelerated because it would be 4 semesters rather than 5 semesters because a student already has many of the prerequisites completed. Now, one of the reasons why so many people have heard of UAB and we have the great ranking that we do is because of those graduate programs that we offer in the specializations. And we do offer so many pathways at the graduate level. So as your student continues their education, we're going to encourage them to seek out their interest at the graduate level to continue their education. Nursing is a lifelong learning opportunity. Now, we mentioned our national ranking. We mentioned the opportunity to do clinicals over at UAB, which is an academic part of our Academic Health Science Center. Another reason for being an allied health system, students in their freshman and sophomore year will have the opportunity to complete their anatomy and physiology courses in a cadaver lab. That's something that's very unique here at UAB, and we do help other schools who need that cadaver lab experience. But the cadaver lab is for anyone who decides to donate their body to science. They would have the opportunity to work within that cadaver lab. And that's specifically designated for any student who's going into a pre-health or pre-medicine type program. Our faculty, the programs that we offer are all diverse. I'm so happy to say that UAB produces a quarter of the male nursing population and at least a quarter of the diverse nursing population for the state of Alabama. And we work really hard to ensure that our programs are diverse. In addition, Dean Harper mentioned our NCLEX pass rates. Because a nurse has to have that NCLEX in order to become a nurse, we work really hard to ensure that those students have great first-time pass rates. Now, we do not teach to the test, but what we do is teach to ensure that our students know how to be great test takers. And that's really about preparing, right? And so what we do is those students who are unfortunately not successful the first time, they will have the opportunity to do remediation. And in a little while, we'll talk about some of the things that we do to ensure that they are successful. And also we offer scholarships. So we'll talk a little bit more about scholarships in just a moment. Now, those interprofessional simulations that were discussed, those are the opportunity for students to, once they're in the nursing program, work with students in other professional programs, whether that's medicine, physical therapy, public health, occupational therapy, dentistry, optometry. And we're trying to make sure that our students know how to communicate with students of other professions. As a new nurse, it's oftentimes very intimidating to know when to call the doctor, when it's the right time, or at 3 o'clock in the morning, I know I'm going to have to call the doctor and I know I'm going to wake them up. And it's very likely going to be a very uncomfortable conversation because they're probably going to be grumpy, right? And so if I know how to communicate what they're looking for in their assessment of this patient, if I'm clear, concise, and follow up well in this communication of the assessment, then I'm going to be able to get the answers I'm looking for to go back to my patient and follow up as well. So that's what we're looking for. We're trying to make sure that our students are very clear in their communication, in their follow-up of their assessment, because everyone goes forth in their assessment in a slightly different manner. So it's all about the preparation, and it gives you the ability to meet students from different professions. We know that not every student plans to stay in Alabama or work at the same hospital. So maybe you meet people who go off to work in other states and other hospitals, but you need to lean on them for a certain expertise because your hospital doesn't offer a certain specialty area. That gives you the opportunity to pull upon the people you meet here at UAB down the road, or maybe you're looking for a reference for a certain specialty down the road. Use what you have to build upon for future opportunities. Everything that you do here at UAB is a future opportunity to build your network. Now, what you see on the screen here is just a few of the hospitals we use for our partnership and networks to get your clinical experiences for your students. So you heard the dean talk about UAB specifically being a magnet facility. That means that they have ensured that their nurses have everything that they need to be great proficient nurses to continue their education. One of the many reasons why so many of our students love to go to work at UAB upon graduation is that they offer 100% tuition reimbursement for students to go back to school with no contract. So upon graduation, if you decide you want to go back to school, you can come back to continue your degree as long as you're working full-time at the hospital. So that works for pretty much every single nurse practitioner program that we offer because it's a distance accessible program. The one program that doesn't work for is the nurse anesthesia program because you do have to be in an on-campus format for most of that program, and you can't work full-time while you're in majority of that program. But if you want to be a nurse practitioner and you know that's something that you're interested in doing, it certainly is a great opportunity. But all of the other hospitals you see listed here offer some kind of tuition reimbursement option, whether it's Children's, the VA, Brookwood Baptist. So there's so many great opportunities no matter what hospital you go to work in. Between Children's Hospital and UAB, they see just about 2 million visitors per year. The clinics at UAB see almost 1.5 million visitors a year. Children's Hospital sees 97 to 98% of all pediatric oncology patients for the state of Alabama, the entire state of Alabama. So the experiences that you would get at UAB are unprecedented. UAB is also one of 12 schools of nursing that have a VA partnership. So we specifically partner with the VA if we have a student who's either interested in going to work within the federal system, or maybe they are a former veteran, or they are a veteran, or maybe looking to go into the military and have a specific interest in working with the VA. Then we have a pathway that allows you to partner and get specific clinical experiences within the VA system. If this is something you're interested in, please let us know and we will connect you with the appropriate faculty members. Let's talk a little bit more about how you become a nursing student. So there are specific steps you have to take. The first step is you will be assigned as a pre-nursing student or interest in nursing student. So that is your first 2 years. If you came to UAB and you do have a certain number of maybe AP, IB, or dual enrollment credits, then you may come into the program earlier than 2 years. But for the most part, it takes a student 2 years before they're ready to come into the nursing classes. One course that every student will take is an orientation class. And this is something to help prepare you. No matter what class you take, it will either be a nursing orientation, or if you're in an honors class, it would be an honors orientation class. But specifically, we're trying to make sure that you're prepared. How to think like a nurse, or how to think like a well-rounded college student. We're trying to expose you to the college experience. We're going to, in the nursing experience class, you're going to be exposed to the hospital. We're going to set you up for one rotation over at the hospital during this specific class. We're going to talk about leadership. We're going to talk about time management, calendar, how to put all of that together in your first 2 years, and why it's really important. Because if you can put all of this together and understand why your time management skills, leadership skills, and all of that are critical in your first 2 years, when you're ready to roll into your nursing classes, it won't be such of a shock to your system, right? Because you're going to be on our time when you get to the School of Nursing. We're also going to talk about volunteer experience or shadowing experience during this class, and why that's an important part of your preparation for nursing school. Now, this class is going to be taught by your advisors. Your advisors are a critical piece to your whole experience. And if you think of me as your biggest cheerleader and your student's biggest cheerleader, your advisors are your student's advocate, okay? And they are a very critical piece to the whole process. We want them to be their friend, their parent away from home during this process, because if something were to be happening and they're struggling in class, or maybe they go through a breakup or struggling with friends or dorm rooms, then they need to be talking to their advisors. Their advisors are a key piece to knowing who the resources are on campus that they may not know about. So they start to get to know their advisors as early as orientation. If your student has already attended orientation, they've met their advisor. But if you're scheduled to come to orientation, then you will be meeting your advisor, and they're going to help set you up with classes to know what classes to take each semester. You need to be meeting with your advisor no less than one time each semester. This is a map for what your first 2 years would look like. Now, on this screen, you'll see a layout of what the classes would be for those first 2 years. And again, if you've already talked to an advisor, or myself, if you've done a tour previously, then we've talked about what classes will be required. In addition to these prerequisite classes, we've also talked about, in the first 2 years, you can set this pace for your own determination. So that means you can go as fast or as slow as you would like in the first 2 years. Now, if you're a Dean's Scholar, you have to maintain your overall GPA at a 3.0 or a 3.2 in the Area 5 classes. The Dean's Scholar program is anyone who came out of high school and was designated a Dean's Scholar upon admission, okay? So if you're not sure if you're a Dean's Scholar, please ask your advisor. Now, if you would like to choose a minor, that's something you're also going to want to complete during your first 2 years. And nursing students can absolutely have a minor. Some of the most common are the humanities, whether it's a foreign language, public health is very common, psychology. So there are so many options that you can choose for a minor. You just want to try to have it completed before your first 2 years. Also, during this time is a great time that you want to be sure to complete any volunteer, shadowing, or work experience in the healthcare setting. The reason why we want you to have that volunteer, shadowing, or work experience in the healthcare setting is because we want to make sure that nursing is definitely what you want to do for the career. And if you were to do some volunteer shadowing experience during this time and realize that nursing is not for you, then these prereqs can go towards so many other professions that you haven't really, quote unquote, wasted your time, and your advisor can help you get on the right path toward another profession. We can set you up with other advisors in other fields. So we really want to try to help you figure this out early on. And it's okay not to know what you want to do, but if you are certain nursing is what you want to do, then we need to make sure we're getting you fit in the right steps as early as possible. Now, your advisor is also going to be meeting with you as you get close to the end of the second year about your application process for nursing school. In addition to that volunteer shadowing work experience, there's going to be an essay and a resume. We do workshops as you're getting ready for the application process for nursing school. And the essay is typically 1 page, double space. So really a paragraph about yourself. And it's about why you're going to nursing school, why you want to be a nurse. If you've never had the chance, then that volunteer shadowing experience can really play a big part in this process. And then the resume is anything that we're not putting in the essay, a lot of it will go on your resume. Nursing school itself. So your prerequisite classes typically are going to take 2 years, but nursing school is going to take 2.5 years, so 5 semesters. We accept students twice a year in the spring and the fall. We roughly accept 130 to 150 students in both classes. So generally about 300 students per year. I mentioned it's 5 straight semesters. One thing to note, if we go 5 straight semesters, you will have to have at least 1 summer semester. So whether in your prerequisite classes, you could choose if you want to take a summer off. In the nursing cohort, you will not be able to take summers off. If you start in the fall, you'll go 1 summer. If you start in the spring, it's 2 summers, all right? Another thing to note, most university scholarships do not cover summer semesters. So we do have separate School of Nursing scholarships that are available, and you can work with the School of Nursing scholarship director if you're awarded a nursing scholarship. If you need to divide up your scholarship opportunities that's awarded for nursing, then she can talk to you about how to use that scholarship for nursing in the summertime. Now, this is a list of your courses, and I know it can look overwhelming for nursing school, but just note that these are very prescriptive. So you're going to go exactly as it's listed for nursing school, 5 straight semesters. Where you had a pre-nursing advisor your first 2 years, you're going to have a faculty advisor the last 2.5 years. And also looking at these classes, you're going to go and rotate through a lot of different patient populations. So we're going to try to expose you to as many things as possible, as many type of patients, as many type of populations, even community health, critical care, mother-baby, neonatal, cardiac. So we're trying to help you get a good idea, number one, of what you might want to do one day. And let's say you don't have a clue what you want to do. Maybe you graduate and you're still interested in several different things. The beauty of nursing is you're going to graduate as what I call a generalist, right? And from there, it's going to be up to you to decide what you're most passionate about. So you're going to make the decision to go apply for a job at a hospital and choose what you're most interested in going to work within, what population. From there, you can choose to either stay working at the bedside or go get a few years of experience and then come back to school and further your education in one of those populations. Now the NCLEX, let's talk a little bit more about the NCLEX. That is the exam that before you can go work in the hospital, you're going to have to pass this exam. Dean Harper talked about our pass rate. So the national pass rate is about at 85%. Our pass rate is a 97.44% for the first time pass rate. That's an incredible pass rate for our students, and we could not be more proud of them, and we want you to be one of those students. Now, what you see on this sheet or on this screen here is just a few of the practice tools that we have for students. In addition, we have a system called the ATI. The ATI is something that you're going to do throughout the semesters, working within the classroom with your faculty members. And the ATI system, what it does is it's broken down throughout the semester so that you're practicing. Let's say you're working in psychiatric medicine, you're going to have a little ATI skills blitz broken down within that session, or if it's mother-baby. So we're taking like building blocks, and you're working each time throughout that semester so that you're having mini tests throughout the semester, but you're also going to have a larger exam at the end. So there's no possible way we expect you to remember everything by the end of the semester if we're only testing at the end. So we're trying to help you retain as much information as possible. The other thing I will say is that we found throughout the years, if we broke down a class like pharmacology, which is how you're going to learn all the drugs and their interactions, rather than having that class once a semester, we broke it down over a couple of semesters. That way, when you go to work on a floor, we hope that you're going to learn the drugs for your specific patient population. You're already going to be familiar with so many of those drugs. And you hopefully, a UAB nurse is not going to have to refer to their phone every time they need to look up a drug. They're going to be able to recall a lot of that information because we were breaking that information down over a course of months rather than weeks. So that's just a few of the tools that we've used over time to help our students prepare for the NCLEX. Now let's talk a little bit more about the fun things about the School of Nursing experience. One thing I want to encourage you to consider, every student starting out as a pre-nursing student can join the Student Nurse Association. This is something that our students, a lot of people think they can't join until they become a nursing student, but this is a way to kind of get involved with people who are either already nursing students or pre-nursing students, but they're involved in mentoring activities, community activities, they do homecoming, they're involved in networking activities. They can, if you're looking for someone, your advisor is always going to tell you what class you have to take, but if you need advice on maybe what professor to take for which class, your Student Nurse Association peers are the perfect people to ask, right? Maybe you're looking for more community hours to get volunteering. The SNA is the perfect group of people to ask for this information. They also do activities, and this is out of my office, specifically in the Office of Student Success, but we do homecoming, we do kickball, softball tournaments. In your first year, we do a learning community. It's kind of broken up like a Harry Potter theme, but we're trying to help our students, number one, get to know each other, but to also learn how to communicate with each other, to go to each other for help rather than to isolate from one another. We also have a School of Nursing honors program, which I'll talk about in just a moment. And there's other ways to get involved. I would tell you that one of the things our students would recommend to you is get involved on campus because you're going to need a break from nursing school. So use that time, whether you are an athlete, you're in ROTC or other activities, maybe Greek life, use that time. And once you get the time management skill down, encourage your student to get involved. I mentioned honors. So there is the University Honors Program, and then we also have School of Nursing Honors. The School of Nursing Honors Program is an invitation-only program. Once your student is in the School of Nursing, going into their second semester, and they're invited based upon their first semester nursing GPA, which you can see here over to the side. But this is an opportunity for your student to be paired up with a graduate level faculty member, whether they're learning more about graduate school at the PhD, DNP level, which are two different types of doctorate level programs, or maybe they're thinking about a master's degree. But what we're trying to do is encourage their learning, right? Expose them to what is out there beyond bedside learning skills. So it's just a way, it's not committing them to one thing or the other. It's just encouraging their thought process. So it does include 6 credit hours that will be divided up over 3 classes. So it includes an extra class each semester, but those hours, if you're in university honors, can go toward your university honors credit. And when you graduate, if you're both a university honors and a School of Nursing honors, you graduate with both honors, or you graduate with nursing honors. So I hope that helps kind of explain. If you have any questions, I'll be happy to answer. I keep mentioning scholarships. So the School of Nursing is so fortunate to have our own scholarships available. And this is in addition to any university scholarships that you may be awarded. So I implore you, no matter what you're doing, to always apply for scholarships. University scholarships are going to be through the university or through the Be Smart system. Okay, so that is something separate that you apply for. Once you are in the School of Nursing and become a nursing student, your student will receive a sheet of paper or an email, and each semester they're going to be eligible to apply for nursing scholarships via our nursing scholarship director. Now, I mentioned University scholarships are one thing. Nursing scholarships can be stacked on top of university scholarships. So those are not one or the other. They can be added on top of one another. So always apply. And just because your student may not receive a scholarship one semester doesn't mean they can't the next semester. So please do not get discouraged. Always put yourself out there. In the last year, we gave out just under $1 million in scholarships to nursing students across the board. So I think the thing to think about, nurses or friends of nursing are impacted by what nurses do. And that's why we are so fortunate. We do a luncheon every year so that our students can meet their benefactors, those who've donated, because we want to make sure that we make those connections and we're able to thank those who've donated to the school. Now, I've got a few words of advice as we're kind of wrapping up here. The first set of advice is coming from the advisors. These are a few reminders, but there's a few things on here that I want to make sure that you as guardians or parents do hear, because whether you've already attended orientation or you're planning to attend orientation, I needed you to hear this. And if you want to take a picture of this screen, please do. But as you are planning to register for orientation, or you already have, make sure you've submitted your AP or IB scores to undergraduate admissions. Make sure you've submitted your transcripts and your math placement test is completed. Okay, those things are required. Be sure that you check your UAB email and it's connected. Your personal email and your UAB email, connect those two. There's going to be very important videos coming out too specifically. There will be a pre-nursing email from your advisors and a BlazerNet email. So be on the lookout for those particular emails. And then schedule an appointment with your advisor. So make sure, again, that once a semester you schedule an appointment with your advisor. If you're not sure how to do that, you should have your advisor's contact information. It can be found in BlazerNet under the student's picture. That's where your advisor's contact information is listed. And then also be familiar with the add drop date. The add drop date is the absolute last date where you can get refunded for classes that you were to drop or withdraw from. So a lot of people get confused about when they can get their money back on classes. That's a very important date to know. That information can be found on the academic calendar. So you might want to bookmark where the academic calendar can be found. Also, VMask. So VMask for students is where is a tutoring center if your student needs supplemental instruction. So similar to tutoring, but additional instruction, great resources for your student. So VMask is a very important center. And then in addition, the one stop, the little symbol you see over here to the side, if you are not sure, your student's not sure where to go on campus, One Stop is always a great place to start. They are the one stop, the reason for their name is the one stop place on campus, a place you can go if you are not sure who to go to. So, and also looking for places or where to go to get healthcare experience as we talk about getting volunteer shadowing or work experience. Right now, we know that's going to be a little bit harder to get for some students because of COVID. So what I'm encouraging students who have to have it right this moment is to think about doing virtual interviews and things like that, but talk to your advisor because we're going to work on some alternative ways if that doesn't open up within the next few months. All right, this next set of advice comes from students, specific students. One is a current student, one just took the NCLEX and passed the first time. So their recommendation for your student is to always be flexible. That's why you see Gumby over here. Our faculty reference Gumby all the time because if they aren't flexible, it's hard to make it and you're always going to be stressed out. So just be flexible, be ready to move with ebbs and flows as they change, and that's really going to help their stress level. Just know that things may happen sometimes that they can't be in control of. So always start studying early because if they're starting early, they don't have to cram. I always recommend be ahead on your reading because if you're ahead on your reading when you come to class, then you can focus on what's happening in class. And then from class, nursing students go to lab, and you want to be able to have fun in lab because that's where your hands-on instruction happens. So the professors are always there to help you guys and help the students. So just remember that and get assignments done early, similar to what we were saying. One of my sweet students, he said, if you're on time, you're behind, right? So again, just make sure you get it all done early. So, and this is just a final thought here, but getting to know your advisor, the volunteer shadowing. A lot of people think about going into nursing because they don't have to do as much in the way of grammar and writing, but that is actually incredibly important for nurses this day and age because everything that they're going to do is going to be put in an electronic chart for the rest of history. So they really need to focus on doing well in their literature, in their English comp classes, because that is going to have an impact. It's also going to have an impact when it comes to writing their essays. So if grammar, construction, writing skills are not their favorite topic of conversation, we have a writing center at UAB, and I would say lean on that. Again, scholarships, competitive GPA is always going to be important because if you don't have the GPA, then you're not going to be able to get to where you want to go. So I would love to open it up to any questions. Again, my contact information is here at the bottom, and I believe Meredith has been taking any questions that we have coming in. So please feel free to let me know if there's anything I can do to help you all and help your students.
Wonderful, and thank you, Annalie, for doing all of this. So again, for our family members that are joining us through the presentation, both either through Zoom or through Facebook Live, we are monitoring both sections. So if you have any questions and you're watching through Facebook Live, you can put it in the comments section. And then for those of us that are joining through the Zoom webinar platform, you just put it into the Q&A function or box down at the bottom of the screen. Hopefully my sound is coming through a little bit better. I apologize again for my sound from earlier. We did get a question that, or not a question, I shouldn't say that. You did get a great tip that came through, or comment that came through on Facebook Live, Annalie, that was saying that these are some really great tips for our students. So they're already seeing and foreseeing the use of the information that you're sharing. So thank you so much.
Absolutely.
Again, just as I'm going to give people time to process those questions, because if you're anything like me, you take it all in and then it takes a second to come up with what the actual question is. But I just wanted to also say that this presentation, if there is someone that you want to share this information with at a later date and time, this presentation will be live. We'll continue to sit on our Facebook page, as well as will be placed out on the Parent Family Services website within the next few days. Okay, so there is a question that came in about when is the best time to contact their student's advisor regarding volunteering positions. And then I think also, like, what year should they start to be really looking to do that?
So that's a great question. So we're going to recommend that be done in your freshman and sophomore year. And I would say is have it completed hopefully by a few months before the end of your sophomore year. So if you can go ahead and start talking to your advisor about that, once you get settled into college and kind of get comfortable with what your classes are going to be your freshman year, then it's a good time to go ahead and start having that conversation, because nurses are not only going to be the only people who are going to be looking for those opportunities. You're going to have people from a lot of other majors who are going to need those volunteer experiences. So go ahead and have those conversations as soon as you're ready. And just remember that as a volunteer or shadowing experience, you're not going to be able to put your hands on a patient. You're going to be more of in an observation role. So as you're looking at those, a lot of students get disappointed when they aren't able to get more hands-on experience, but unless you actually take the job, those are more hands-off roles. And what we're looking for is just, again, to make sure that you know, can you handle the sights and the smells and the sounds of the environment that you would be in every day? Is this something you can be committed to? Do you like the way the nurse interacts with the patient? Or would you rather be more behind the scenes in a rehab services type role as a physical therapist? So just how would you prefer that interaction to look like based upon your personality style? And that's what we're looking for you to get out of those experiences.
Well, and Annalie, adding to those regarding the volunteer experiences, is the expectation that the students complete those volunteer experiences in Birmingham with our partner institutions that you mentioned, or are they able to take advantage of maybe doing, if they're not from the Birmingham area and they're home over summer or other breaks or at any other time, does it have to be just in UAB or can they do it elsewhere?
No, anywhere is fine. So what we usually recommend is 60 to 100 hours. So somewhere in that time frame. So yeah, anywhere is fine. We just want it to be after high school graduation. So we want it to be once you've kind of gotten out, because a lot of high schools do offer, whether it's a HOSA or Healthcare Academy program, but we want this to be hours that you go out and seek on your own. But you can certainly put certain things on your resume if it maybe was in high school, but we're really trying to build a college resume and a college essay.
Great. There's a question, you were talking about scholarships earlier. Where is it that they need to go back and look for additional scholarship information for their student, or where can their student go look for additional scholarship information?
So university scholarships will come from the university when you apply based upon your GPA. So that's tied based upon your ACT and GPA, and they're automatically tied together when you apply. If you're not sure who to contact, you're welcome to email me and I can put you in contact with your college admissions person. The other one, if you haven't attended orientation just yet, is going to be the Be Smart system. It's the letter B, the word SMART, and that is a system that every student is going to be able to create a profile. I always say, if you think of it like a matching profile system, it's going to match the student, and it's really like a national portfolio system where it's going to match you up to thousands of possible scholarships across the country. And you could be a nursing student and match to a history scholarship depending upon what you put within that profile. It's all based upon questions you answer, how you answer them. Some are going to offer you the opportunity to complete an essay. And if you decide to complete the essay, it could match you up to further opportunities. So it depends on how thoroughly you want to complete that profile. In addition, once you get to the School of Nursing is when you become eligible for nursing scholarships. So there are possibly other nursing scholarships out there, or maybe there's things tied to, as a parent, to your employer. So there are things out there that we do not control through UAB that you may find. Some organizations, credit unions, banks, and things like that, that certainly are available out there that you can search for independently. But those are the things that are specifically available through UAB.
Perfect. Thank you so much. Those are all the questions that I've seen come in at this point. Again, I just want to reiterate, and I don't want to hold family members or anyone, or Annalee, especially you, beyond the hour time frame, but if questions do appear or arise later on, I know you are very open for individuals to reach out to you, as well as please feel free to reach back out to the Office of Parent and Family Services. We are here to help connect, to make sure that you are getting the information you need to know in order to ensure that your student is starting out the semester correctly. Annalee was just walking through a lot of the scholarship information. There was actually a webinar last week called Money Matters. If you didn't get a chance to see that presentation, that is out on both the Parent and Family Services website as well as on our social media, our Facebook page. You can go and rewatch that, and that will talk about both the various options of scholarships coming in and Be Smart and how those are applied for everybody, so that there's continuing resources on, because it does all build upon each other, each part of these things that we just are discussing. So thank you so much for taking the time today to learn a little bit about the area of the School of Nursing, especially because it is such a phenomenally regarded program and phenomenally a program that is able to provide so many of our students with so many great opportunities and things. And so, Emily, I really want to say thank you to you for taking the time this afternoon to walk family members through this and to share the opportunities and programs and services and experiences beyond that our family members can expect their students to take advantage of during their time here at UAB.
Absolutely. We really look forward to seeing everyone and getting to know you better as they get ready for the program. So have a great summer, everyone.
Yes, definitely have a great summer, everyone. Again, if you have any questions, please reach out. And hope that you have a wonderful weekend ahead, or week ahead, rather. I'm already apparently skipping to the end. And then we'll just see everyone very soon, we hope. Thank you to everybody.
Bye-bye.
Bye.